there has been many attempts in the past to normalize intestinal permeability because it has been suspected that is related to several autoimmune diseases and also cancer, but there was no means to overcome, to solve this issue. And actually, we were the first to demonstrate that an increased intestinal permeability was reversed, and this was reversed by a diet containing only meat, fat, and organ meat. And since this first instance, we have replicated this many times.
Welcome to the Fundamental Health Podcast. I'm your host, Dr. Paul Saladino. This podcast is the result of my relentless search to understand and correct the roots of chronic disease and illness. In this podcast, I will share with you everything I have learned about how to live the most healthy and radical life possible. Thanks for joining me on this journey. What's shaking, everybody? So this week I interviewed Dr. Zsofia Clemens from the Paleo Medicina group in Hungary. And one of the cool things about the Paleo Medicina group is that they are using a high-fat, nose-to-tail carnivore diet, which they call a Paleolithic ketogenic diet, to treat patients and recording many of the findings. If you go to the website, which is paleomedicina.com, you will see that they have numerous published case reports, including remission of Crohn's disease, as we talk about in this podcast, reversal of type 1 diabetes with preservation of the pancreas's ability to produce insulin. You may know that in type 1 diabetes, there's an autoimmune attack on the beta cells of the pancreas, and in most patients, that destroys the pancreas so that the pancreas can no longer produce insulin. But the Paleo Medicina group has reported a number of cases on their website, and we discussed this in detail during the podcast, in which early enough institution of a Paleolithic ketogenic diet that is a high-fat, nose-to-tail carnivore diet resulted in resolution of the autoimmune process and preservation of pancreatic function. So pretty darn incredible. There are so many people. I think that as the carnivore diet gets to be more and more popular, there will be more detractors, but I really appreciate the work that Paleo Medicina is doing. And I hope that in the States, we will soon have something like this here, where we can scientifically study the results of instituting a carnivore diet. There are just so many people knocking the carnivore diet, and I believe, as Rob Wolf has said, that the market will decide. And the number of people who are benefiting from a carnivore diet is much, much greater than the people who are knocking a carnivore diet. So I will continue on my crusade. I believe in this way of eating profoundly. I am continuing to work on the book. Listen to the end of the podcast if you want to hear what I am up to. But I think you will seriously enjoy this conversation with Zsofia Clemens. She is the head of Paleo Medicina. She's a neurobiologist, a neurological researcher, and she is well published, as you can see from her CV, and many of her publications are on the Paleo Medicina website. So this one is cool. We talked about high fat, high protein, nose to tail, caloric restriction. I will say that I don't necessarily agree with the food limitation that sometimes Paleo Medicina suggests. I think that many people do overeat, but I think that we should be eating to satiety, and we should not be limiting food, especially when nutrients are involved. And I think that once we create a healthy diet, satiety will follow and appetite will follow pretty much seamlessly and effortlessly in most cases. So I think you guys will learn a lot from this episode with Zsofia Clemens, and I appreciated having her on mucho. As you know, this month the podcast is sponsored by White Oak Pastures, this amazing 6th generation. Last week I said 5th. It's actually a 6th generation farm that has been in existence for 150 years in Bluffton, Georgia. This week I posted a really cool video of the butchers at White Oak Pastures steak dancing. White Oak Pastures is regenerative. They do rotational grazing. They have been shown to be carbon negative. They are an amazing group of people revitalizing the community of Bluffton, Georgia, producing grass-fed, grass-finished, very clean, basically as good as it gets, grass-fed meat, beef, etc., lamb. They do turkey. They do pastured pork. The Iberian pork fat is coming back into stock soon. They have so many things. They do chickens. They do eggs. It's all on basically a very intentionally, kindly run farm in the best thing possible. If we could scale, or when we do scale farms like White Oak Pastures, I believe it would be fundamentally, profoundly paradigm shifting to the way the ecosystems work on the earth, and people would really see that properly done agriculture can be carbon negative, it can sequester carbon in the soil, as opposed to the carbon positive veggie burgers. And though we probably need some factory farming or factory traditionally grain-fed agriculture now, I think that the more we can allow farms like White Oak Pastures to thrive, the more of this type of agriculture, the better in so many ways. In so many ways, the meat is healthier, there are less pesticides, less toxins, the cows are not grain-fed. Obviously, I'm a huge advocate for grass-fed and grass-finished meat. Get what you can, but White Oak Pastures is about as good as it gets. This month, they are offering a 10% discount if you use the code CarnivoreMD. And as I mentioned earlier, if you do a steak dance on Instagram, tag me at CarnivoreMD, tag them at White Oak Pastures, and hashtag it steak dance, you will be entered into the drawing to win a $100 gift certificate to White Oak Pastures for the best steak dance. So check that out, you guys. Support this farm, at least educate yourself about what they are doing. They are also connected with the Savory Hub. I'm hopefully going to connect with the folks at Savory soon. This podcast is sponsored as well by my friends at Ancestral Supplements, the good people at Ancestral Supplements who are changing the world in so many ways by promoting their ancestral and nose-to-tail organ message. And they have got a new supplement coming out, which I'm super excited about. So as you know, they have a full line of grass-fed supplements in gelatin capsules from New Zealand. And the new one is intestines with tripe. And tripe is stomach. So they're doing intestines with tripe. So check out this quote from a Native American, John Fire Lame Deer, that extols the virtues of eating guts. He says that in the old days, we used to eat the guts of the buffalo, making it a contest. Two fellows getting hold of a long piece of intestines from opposite ends, starting chewing toward the middle, seeing who can get there first. That's eating. These buffalo guts full of all of their nutrients and collagen. You don't need any pills or vitamins when you swallowed those, was the quote. So pretty cool stuff. And the intestines include the intestines and the stomach and the other gelatinous parts of the digestive tract, which with concentrated amounts of connective tissue, collagen, gut-specific proteins that we don't get anymore. The intestines have always kind of been treasured for lots of reasons. Maybe it was because of what they contained, or maybe it was because of the unique things in the intestines. We know that the intestine has a large immune system associated with it. I think one of the cool things about ancestral supplements and eating nose to tail is we quickly begin to realize that there are magical, I mean, I'm joking, obviously they're not magical, but there are really unique nutrients throughout the animal, not just the muscle meat. And whether we're eating liver or heart or pancreas or brain or scapular cartilage or tracheal cartilage or special types of cartilage like the intestines and the gut and the stomach, we are getting unique nutrients. Thymus is another good one, particularly rich in vitamin C and unique things. I think the more of these we include in our diets, the more we mimic our ancestors and the more nutrients we are giving ourselves, obviously without any plant toxins, which is my impression of the ideal diet for humans. So check out ancestralsupplements.com, see what they can do for you. They are putting back in what the modern world has left out. You can use the code SaladinoMD for 10% off at their Shopify site. We have another new sponsor this week, which is pretty cool. It's Native Deodorant. And what I like about Native is that it's natural. There are so many sort of nasty things in other deodorants. And as I've talked about in the previous podcast with Anthony J., parabens and other things which can be estrogen mimetics or mimickers, that when I am looking for a deodorant and personal care products, I really appreciate for companies like Native that formulate it with this stuff in mind. So Native doesn't have any aluminum, which is probably not a good thing, and doesn't have any parabens, which are those xenoestrogens, no talc. It is found with ingredients that occur in nature. They do no animal testing, and they have free shipping and returns, so there's no risk to try it. They sent me a sample. I got the eucalyptus one. I really liked it, and I will tell you guys that you don't have to sacrifice odor protection when you're going to a more natural product. That was one of the things that used to bother me about deodorants, and I really appreciated that the Native stuff worked well. You can take my word for it, or you can look at the over 8,000 five-star reviews they have online. They have been featured on the Today Show, Elle Magazine, Pop Sugar, Refinery 29. They are well-loved and widely used, and I think you should check them out. So if you are interested in checking this out, if you are wondering what deodorants to use, they have all sorts of scents. They have coconut and vanilla, which is the most popular, lavender and rose, cucumber mint, eucalyptus mint, scents that women may like, scents that men may like. And like I said, they offer free returns and exchanges in the US. So you can use the code SALADINO, just SALADINO, SALADINO, for 20% off your first purchase at nativedeodorant.com. Check that out. Let me know what you think of this stuff, because I really appreciate people that are creating products for both personal use and for hygienic use that are free of nasty things. So Native is doing a good job of that with deodorant. I think you should just check them out. Saladino at nativedeodorant.com. Okay, so without further ado, on to the episode. Listen to the stuff at the end of the episode if you want to hear what's going on with me. I've got lots of cool stuff going on and coming up, but enjoy this conversation with Zsofia Clemens. All right. Welcome to the podcast, Zsofia. Thank you so much for being here. There are lots of people who have been requesting that I interview you, so I'm quite grateful for your time and the information that we'll share.
Thank you for having me.
How are things in Hungary today? How's the weather there?
It's hot.
It's hot?
Yeah.
How hot is it in Hungary?
32 degrees, something like that.
So it's pretty hot.
Yes, it is climate is continental, so very hot summers, very cold winters.
Wow. Okay. So you're connected with the group of Paleo Medicina, and I just want the listener to know that when I started my journey on the carnivore diet, your information was some of the stuff that I found quite helpful. And that right now, in terms of my own personal diet, it looks a lot like what your group terms the Paleolithic ketogenic diet. So I really appreciate the work that you guys are doing. How did you guys discover this? Or how did you guys develop these protocols? What's the backstory here? Do you have a personal story? How did Paleo Medicina come to be? And what was the genesis of this type of a carnivorous diet?
Yeah, so the Paleo Medicina was founded by my colleague, Dr. Csaba Tóth. So he's responsible for the basic idea. And he started with a paleo diet, as it is generally perceived. And he has been treating patients around 2010-11. And it turned out that the paleo diet helped a lot of people who have been struggling with overweight, hypertension, diabetes. But it didn't seem to affect more severe conditions like cancer, autoimmune diseases, or complicated, over-medicated patients. So step by step, he fine-tuned the diet, and by excluding plant components, vegetables, fruits, and actually all supplements. And I'm coming from the other side because I have been dealing with epilepsy patients for 15 years. So I got quite a good knowledge about what the ketogenic diet is and how it is implemented in epilepsy patients. And I also see the positives, but also the limitations of that diet. So actually, we joined the knowledge of the two of us, and it turned out to be that the diet has to be Paleolithic, in terms that it shouldn't contain those food items that were actually not available for the prehistoric man either. Okay, like paleo cookies, tomatoes, and obviously modern time vegetables or supplements. They should be skipped. And at the same time, the diet has to be ketogenic to bring all the benefits that is possible. So it was a gradual process to develop the PKD, and the whole thing was based on patient feedback. So it was not done on a theoretical basis. So we didn't Google the internet. Of course, we did Google, but it was only the second step. The method was fine-tuned by feedback from patients in the first place.
And this is quite an interesting progression because the stories that I've heard of people who find improvements when transitioning from a paleo or a ketogenic diet to carnivore are some of the most intriguing to me. I think that a Paleolithic diet and ketogenic diets are quite helpful for a lot of people. And what you highlighted there is so striking that I'll just recapitulate it for people. Your clinical observations mirror many of the things that I've noticed, that for some people, paleo and ketogenic diets are enough, and they might help with obesity, they might help with diabetes. But for a lot of people with autoimmune disease or what appear to be more severe inflammatory conditions, these diets don't always give us the clinical results that we're looking for, right?
Yes, exactly.
And so on the website, so I'll encourage people to check out the website for Paleo Medicina because there are a number of really great case studies that you guys have referenced and published there. You highlight this a little bit. You mentioned that there was a case of someone who developed atherosclerosis, so coronary artery disease, while they were on a Paleolithic diet. What were the limitations of a paleo diet that you observed beyond sort of lack of resolution of autoimmunity and inflammation?
So actually, the paleo diet is not controlling inflammation or not in the desired extent. Sometimes there is even an increase in the inflammation. And we know because we follow up patients with regular laboratory checkups. And this is what we see. And as we know, an elevated CRP or any other inflammation marker is predicting a prolonged disease or progression of the disease instead of the opposite. And this is for the future. And at the same time, the patient cannot necessarily feel the level of the elevated inflammation. So he or she may be feeling okay with eating her favorite cookies and so on. But the process is there in the background. And this patient was very happy for his paleo diet for 7 years. Okay, so that's quite a long time. And in 7 years, you can develop a new atherosclerotic disease despite losing weight in the beginning. So there are something you can win with the paleo diet. This is weight loss, but after some time, there are effects that you cannot compensate for. And after a certain amount of time, these negatives will prevail over the positives. And this is the same when speaking about other dietary transitions. Okay, so we have seen many patients doing the transition from the classical ketogenic toward the PKD, from the autoimmune paleo toward the PKD, carnivore toward the PKD. And the experience is always the same.
And what is that experience like as people are transitioning from let's just say a more traditional carnivore diet? That's kind of an oxymoron, but if people are transitioning from a high protein carnivore diet, we'll define the PKD in a moment, but what's the experience of people transitioning from ketogenic, Paleolithic, or higher protein, higher meat carnivore diets to a Paleolithic ketogenic diet, the PKD diet?
Mm-hmm. So actually, we have a lot of experience lately from the last 2 years, because most our consultation requests are coming from the Carnivore Society,
Mm-hmm.
through the Facebook, Twitter, wherever. So they are already not eating plants. Usually they are already not taking supplements, but still have symptoms. And in most cases, the symptoms are very much alike. So this is why I can tell you this with quite certainty. And their blood work is tend to look the same. And the leading complaint is being tired, fatigued. Okay, and this is opposed to the initial period of the transition when they reported a jump in their energy level after skipping vegetables, fruits. But with time, this switches over, and the tiredness and muscle weakness dominate. And the second one is not being able to lose more weight. Okay, they stuck with the weight loss. They are losing weight. Of course, if you change a Western type diet or carnivore or vegetarian diet to a non-plant food, no cereal diet, you will be losing weight, but then you will stuck with the weight loss. So that is the second one, and there are other complaints like diarrhea, bloatedness, bad breath, and these are just the common symptoms, and then we did not yet speak about the specific diseases these patients may have: cancer, autoimmune diseases.
What do you see on the blood work? I think a lot of people are interested in blood work, and I am going to release a whole podcast on blood work. What do you see characteristically in the blood work of these patients who are on higher protein carnivore diets?
So elevated BUN in the first place,
Mm-hmm.
but there's a cluster of parameter that is changed, that is out of the range. So BUN, creatinine, uric acid, glucose, these seem to be elevated, and on the other hand, vitamin D or folate, sometimes even iron, may be decreased, which is strange because these people are eating red meat.
Right.
Pounds of red meat and still having iron deficiency anemia, which is strange, isn't it?
Yeah, it's very strange. Do you ever see elevated liver enzymes, ALT?
Yes, we do see them frequently. Usually it is related to a contaminated food.
What do you think the food is contaminated when you see the elevated liver enzymes?
Actually, any chemicals,
Mm-hmm.
ALT, AST, are indicated any chemical elevation, and it is very difficult to find out. We just know from experience that, for example, shifting from a supermarket obtained egg to a real egg, or skipping eggs entirely. And of course, there are certain food items that are specifically prone to being contaminated, like certain fishes or fish roe,
Mm-hmm.
or farmed animals.
Farmed animals. So the quality of the food is critical.
Yes, it is critical, especially if you have a serious disease.
One of the things that I've found interesting recently in my personal experimentation is the quality of eggs. And a lot of people have their own chickens, and that's amazing. And I'm totally jealous of them because they can get very good quality eggs. But I found myself thinking about the quality of the eggs in supermarkets, even though I was getting organic or pasture raised, quote unquote, eggs in the grocery store. I thought, I wonder what these chickens are actually being fed. And I had this suspicion that I haven't been able to explore fully, that perhaps eggs are one of the dirtier foods that people are eating. I can get meat that's grass-fed. I really like White Oak Pastures and US Wellness Meats here in the States. And my suspicion is that in general, grass-fed meat from good producers is probably cleaner than organic eggs, because even these organic eggs are fed a bunch of grains. They might be organic grains, but they're fed grains, they're fed soy. That it's pretty hard for those of us who don't have chickens or know someone with real chickens, quote unquote, chickens that are running around and eating bugs, to get really high quality eggs. It's interesting that you mentioned that eggs are one of the ones that can be kind of subpar in terms of quality.
Yes, this is based on experience. So the
Yeah.
difference what we see after excluding, because you do not have a laboratory at home, and even if you have a laboratory, what you do? So if an egg is contaminated, so just go on with the symptoms and see if there is a change in the symptom, and if there is no possibility for weight, because there are diseases where when the time factor is important, just start a diet without eggs. And actually there is nothing in the egg that wouldn't be there in the lamb, in the sheep, in the organ meats. Actually there is nothing. It is actually much less nutritious.
Right. And one of the things I've talked about in the past was excluding egg whites. But the more I've thought about it, I think for some people who are not finding the improvements they want, even excluding the egg yolk might be an important piece of it. And I love what you're highlighting there, that when I've looked at this, my research has kind of mirrored your statement that kidneys and liver and the organ meats in combination with fat and muscle meat will provide everything that's in an egg, and there's really no deficiency when you're eating the animal like that.
Yes, it is much less variable, but not less valuable nutritionally.
Right. Yeah, there's a little less variety. You mentioned inflammatory markers. I'll just ask you about this briefly. What inflammatory markers do you follow? You mentioned HSCRP. I find that one valuable. I'm just curious what other inflammatory markers you all will follow, generally speaking.
We are also looking at the fibrinogen.
Mm-hmm.
And for the follow-up of some cancer patients, we look at the deep inflammation markers like interleukin-6.
Mm-hmm. Yeah, some of the cytokines like interleukin-6 are quite esoteric, but I think they could be valuable. It seems like TNF-alpha and IL-6 are probably some of the more sensitive ones, but I don't run them on all of my clients and patients. But I think that HSCRP, fibrinogen are pretty good inflammatory markers, and those are pretty easily obtainable.
Yes.
So let's highlight for people the difference between a Paleolithic ketogenic diet and let's call it a more mainstream carnivore diet. I want people to make sure that they're understanding the terminology here. So tell me what, on the Paleo Medicina website, you guys actually have a great article which says this is our protocol, this is how we do the diet. But let's explain for people how you guys construct a PKD, or a Paleolithic ketogenic diet.
So the PKD is more defined, more circumscribed as compared to a carnivore diet. Which is the carnivore diet is existing in many variations. There are many personal approaches, which is not good. If you are a patient and have to start with the best available diet, then it can be confusing. So the PKD is a diet that is based on animal meat, fat, and organ meat, basically. There are two forms of it. One is allowing for 30% of, so to say, paleolithic vegetables, fruits, for those who are already recovered and can do some allowances. But for the patients, you should be, if you're a patient, you should be doing the 100% animal-based diet. Then the next thing is that the diet has to be ketogenic. Okay, so you have to do the correct protein to fat or meat to fat ratio and a correct amount of what you're eating in order to maintain ketosis. And the third thing is that you have to eat organ meats so that you can have all the vitamins and minerals that you need. So this is actually the essence. There are minor issues, but this is the essence.
Mm-hmm. What is the ratio of protein to fat that you recommend for people, muscle meat to animal fat?
Yes, so when speaking of macronutrients, then it is 2 to 1, and 2 goes for the 2 goes for the fat, 1 for the protein.
In terms of grams?
In terms of dry matter content, right. Grams. Mm-hmm. So if it translated into meat and fat, it is 135, more or less. Okay, there may be some variation in this ratio, but the 2 to 1 is something that is good. This is one thing, and then the other one is that you have to stick to your real physiologic need. And this is something that is challenging for those who are arriving from a carnivore society, because there is this tendency of eating just too much. And if you are eating too much of anything, you will be out of ketosis. And then even eating too much fat can kick you out of ketosis.
Oh, interesting.
Okay, not even speaking of too much fat and too much protein at the same time. Uh-huh. So doing the ratio is not alone. You have to eat according to your need and not more than that.
So one of the things that people get a little confused about, that let's clarify for them here, is that a pound of meat, and so a pound of meat is 454 grams, give or take, I believe. And in a pound of meat, there are about 100 grams of protein. But what we're talking about here is for every gram of protein, you want to get 2 grams of fat. Is that correct?
Yes.
So
That's it.
sometimes people will ask me and they'll say, oh, is it for every gram of meat, I want to get 2 grams of fat? And I say, no, it's like you said, it's protein dry weight. So a pound of meat is about 100 grams of protein. So for every pound of meat, you want to get about 200 grams of fat.
Maybe a little bit less.
A little
Than that.
less than that
Yeah.
in terms of what would be less?
Because I'm calculating in grams. I'm
Uh-huh.
not that good with the pounds.
Oh, okay, yeah.
But the ratio is 135. 100 gram of meat, 35 grams of fat.
Oh, okay. So for every, if you're actually not, if we're taking the non-dry weight, so if we're actually looking at every gram
Just
of
speaking of meat and fat.
meat and fat, rather than
Yes,
translating it to protein. So
yes,
for,
because it's more complicated and patients get confused.
yeah.
So
And so it's about, in terms of actual weight, it's almost 3 to 1. So for every one, for every one unit of fat, you're going to eat about 3 times that in terms of protein, in terms of actual meat, not protein. So hopefully I'm not confusing people more, but
yeah, more or less.
we're crossing over between the actual weight of the meat and the protein content of the meat, but hopefully that helps people. So if you're thinking about it in terms of non-protein, if you're actually just thinking about it in terms of weight of meat versus weight of fat, it's about 3 of protein for 1 of fat. So if people are eating 100 grams of meat, they're going to eat about 35 grams of fat.
Yes, exactly.
Okay, perfect. And then we can also there are other ways to talk about that, as we were discussing earlier. If we convert that to the actual protein content of the meat, which is where we get the 2 of fat to 1 of protein ratio.
Yes, exactly.
Okay, great. And then
and then again, do not overeat.
Do not overeat. Okay, well, we can talk about that too.
Do the two things at the same time, the ratio and the amount, and that will be fine.
How can people know how much food to eat? Where do you see people running into problems with overeating?
So it can be seen from the glucose readings, ketone readings, but most specifically we can see it from the blood work. So patients are usually coming with a baseline blood work, and then we ask them doing a follow-up blood work at 3 weeks. And that will be the most specific thing to base our feedback on.
And again, what are you looking for in that follow-up blood work?
It is a comprehensive blood work covering inflammation markers, metabolic parameters, liver function, kidney function, urine. Yes, that's it. And of course the vitamins and the minerals as well.
So you want to see the blood work looking good. You don't want to see inflammation. You don't want to see elevated fasting glucose. You don't want to see elevated BUN. You want to see all the blood work looking good. And that's an indication of sort of the fat to protein ratio and the amount that they're eating. Is that your perspective?
Yes, there may be other confounding factors that should be taken into consideration. Sports activity may distort a little bit the blood work, or the medications taken, or supplements, or there may be a few other things.
Yeah, and we'll dig into the supplements and intestinal permeability as well. And so we talked about the fat to protein ratio. Where do you have your patients get fat? Because in the US, we often run into this issue. How do people get this much fat? I've started eating suet, which is perinephric kidney fat, and organ trimmings. I think I've heard you say that in Hungary, there are fattier cuts of pork. How do your clients get this much fat?
In Hungary, it is easy.
Yeah.
And it is also easy in Central Europe, because traditionally it is more in the culture of the people eating fat. The western part of Europe is not that easy, and America and the yes, or Canada is the worst to have the sources and the good quality sources. So we have a lot of smoked meats here. That is the way. That's the traditional way of preserving fat and meat. Actually, this is a very safe way. It can be done without any preservatives, just by itself, just by the cold smoke. But these are not available in the US, or if they are available, then they are containing additives like nitrites, nitrates that should be avoided. So yeah, so it is the fat trimmings, the sweat, and the tallow that is remaining for you.
Okay.
Unfortunately.
Yeah.
Unless you smoke your own meat, but it is not easy.
It's definitely a cultural divide here. We're just not used to seeing fat in grocery stores. But my impression is that in Europe, like you're saying, fat is everywhere and fat is highly prized.
Yes, that's the case. You can get fat sausages, head cheese. There are many forms, so liver pate. The thing is that you have to find the one that is without preservatives. So if you go to a supermarket and if you read the ingredient list, and if there are more than 4 items, that is for sure not good for you.
Right. Avoiding the nitrates is probably a good idea. And a lot of people ask me about bacon. You know, pork belly is one of the fattiest cuts that we get in the US. And I have some concerns about nitrates, even naturally occurring nitrates in things like celery salt, which are added to what are considered to be healthy, non-cured bacon in the grocery stores. So when I have used pork belly as a fat source, I just would go to the butcher and ask him for straight pork belly, because in the US you can get pork belly that's not cured. But whenever we cure meats in the US, there's always nitrates added, or celery salt, which ends up having more naturally occurring nitrates. And I'm not convinced that even naturally occurring nitrates are safe for humans or a good thing. It's sort of it's a rabbit hole to go down. But it is an interesting question here. And I would much prefer non-cured fat. So it doesn't have these additives or preservatives. That's very important.
Yeah, the nitrates are clearly not good, because the nitrites are converted into nitrate within the mouth through bacteria, and then in the gut they are converted into nitrosamine, which is triggering cancer. That is
right. And a lot of people may not know this, but lots of plants contain nitrates and nitrites that can be converted to nitrosamines.
yes.
Often processed meats are vilified for their nitrate content, and perhaps this is something to be aware of and avoid. But the majority of most people's consumption of nitrate-based and nitrite-based compounds is from plants. And as you're suggesting, I've seen the same things, that in the mouth, these can be converted. And in the gut, you can develop nitrosamines from plants, in addition to developing nitrosamines from cured meats that have nitrates added. I think that there's this whole school of thought that nitrates are a good thing, and people do these beet supplements. Have you heard of these in the US?
Yes, I have heard it.
Yeah, and they're thinking,
ridiculous.
Yeah, I'm not sure.
Why should you add a plant-based substance to meat? Because it is your aim to get rid all of the plant-based substances by eating a meat-based diet.
Yeah, and I think these are people who imagine that a beet extract is going to be helpful for them because they've been told that it's going to increase nitric oxide. But I also have large concerns that it could increase nitrosamines as well. And I don't think we need to increase nitric oxide through beet extract and beetroot juice if we are eating a good diet otherwise. But there are lots of, there are tons of people out there promoting beet supplements now, and it's quite confusing for the consumer, who may not be able to differentiate or realize that the nitrates in beets are essentially turning into the same compounds as the nitrates in bacon. And there's a real discordance here, and the consumer is not being educated clearly. So I want to highlight that for people. I'll probably talk about that in my book as well. So what about organ meats? How much do you recommend? Which organs do you recommend your clients eat? I'm a big fan of organ meats myself.
You can eat any organ meats except for gallbladder. You can eat liver, you can eat the bone marrow, the brain, kidney. But the brain and the liver are the most nutritious ones, so you have to include it in your diet for sure.
In the PKD, you recommend some amount of brain and bone marrow per week, right? Your group feels that these are particularly valuable neural tissues, right?
Yes, when it comes to diseases, you definitely have to eat them, because
Mhm.
if you have a disease, it is for sure that your vitamin D and vitamin C are down, because inflammation level is inversely related to your vitamin D level or vitamin C level. So the disease is, so to say, eating up these vitamins. So you have to eat more, and especially in the beginning when you start doing the diet. And recovery cannot be full without eating organ meats.
Mhm. I've recently been eating a lot of kidney and really appreciating it. The nutritional value of kidney is kind of unique. There's quite a bit of riboflavin in kidney and a good amount of vitamin C in kidney as well. So I personally add kidney to that list of kind of like the most important organs. I've also been experimenting myself with some organs that I had not eaten much recently: pancreas, spleen, and thymus. Do you ever have clients eating those kind of more esoteric
Yes,
organs? Yeah,
yes, absolutely. Add sweetbread.
right.
It's a delicacy, for example.
Uh-huh.
Yeah.
How much liver specifically do you recommend your folks eat per week?
It is decided based on the severity of the disease, and whether we are speaking of a child or an adult or sportsman.
Mm-hmm.
But you should be eating at least 2 times a week.
2 times a week liver. So just as a general ballpark for people, what if you had a middle-aged male, so an adult male or an adult female? How much liver would you recommend per week for that person?
Half kilogram, for example.
Okay, so for people who may not be aware, a kilogram is 2.2 pounds. Or what am I thinking? Yeah, a
Yeah, a
kilogram.
little bit more than 1 pound.
Yeah, yeah, yeah.
It's
So about 1 pound of liver per week is what you're recommending for generally for adult men and women.
yes,
Okay. And then what about for brain? How much brain and bone marrow per week?
maybe the half of that.
About half a pound.
Yeah, half
Okay.
of the liver.
Half of the liver.
Yeah,
Yep.
yes,
Yeah.
pound.
Okay. That's it. Okay, that's interesting. It's very hard for us to obtain brain in the US. I'm jealous that can you guys get brain pretty easily there?
Yes, quite easily.
What? I'm so jealous. And what kind of brain are you getting? Is it beef brain? Is it lamb brain?
The pork brain is the
Pork.
one that is mostly available. Yes.
Pork brain. Okay, interesting. Yeah, it's quite a different situation there for food availability in Hungary and Eastern Europe. What about other things like salt or electrolytes? I want to talk about supplements. I want to highlight that and go over PEG 400 testing. So far we've done protein and fat and organs, maybe even leaving out the eggs. What about salt? What about other electrolytes? Do you recommend any of that for people?
Yes, they're recommending salt. But if you are eating this kind of diet, you will be craving for less salt.
Mm-hmm.
So, because actually, the more carbohydrate you eat, the more salt you need,
Mm-hmm.
because of the sodium-dependent channels in the gut.
Mm-hmm.
So, but you still have to eat salt, and not eating salt, which is quite a trend in the carnivore society. I do not think that is a good thing, especially if they are not eating enough fat and if they are not in ketosis.
Mm-hmm. How much salt do you think? I've talked about this a lot with people, and I think people really benefit from having a recommendation in terms of how much salt, which would be sodium chloride, people could ballpark in a day.
I cannot give an exact number.
Uh-huh.
I'm always saying that keep it simple
Yeah, I like that.
and go with your hunger
Uh-huh.
and your cravings.
So maybe just salting to taste, but not over salting food. Does that sound reasonable?
Yes, something like that.
Okay. What about other electrolytes? Potassium, magnesium?
So if you will be eating the PKD, you will obtain all the minerals you need.
Mm-hmm.
Okay, so that there is no mineral that should be supplemented from outside the diet.
Okay.
Okay, so what is frequently brought up is the magnesium, because people on the carnivore diet usually have leg cramps, and this is
Right.
one of the leading symptoms as well.
Right. Right.
And the leg cramp is usually attributed to magnesium deficiency.
Mm-hmm.
Or relative magnesium deficiency. But we did a study that was published maybe 2 years ago, and we took our last 50 patients on the PKD who have been highly adherent to the diet based on their lab works. And it turned out that actually all of them had their magnesium level in the normal range without supplementation. And they also didn't have cramps. Cramps may occur if eating fruits or alcohol, or in the case of the carnivores, that they are overdoing the protein.
Mm-hmm. Were you measuring serum magnesium or red blood cell magnesium in that study?
Serum magnesium.
Serum magnesium was within normal. Okay. But they weren't having cramps.
No, usually do not have cramps
Mm-hmm.
on the PKD.
And so what do you think is going on here with too much protein? What's the mechanism? Because what I'm hearing you suggest is that for a lot of people on carnivore diets, or even people who are not on strict carnivore diets, if they're eating an excess amount of protein, and perhaps we could define how much protein people might need, that this excess protein might be changing the biochemistry. What do you think the mechanism is here underlying this that could be causing the cramps or causing the blood work to be abnormal?
So there is something called a nitrogen balance in your body. Your body is aiming at having the same amount of nitrogen. So the nitrogen is coming from the amino acid that is coming from the protein. And if you eat more than you need, you just get rid of the excess. So there is no point of eating more, because there is an upper limit for the protein usage. Okay,
Mm-hmm.
you can eat whatever or want, or as much as you want, but the excess is just doing problems for you. Okay, especially this is the case if you are not eating fat, because this will result in protein intoxication or fat starving fat. So there is actually two ways or two forms metabolism in the body, and one is a glucose-based metabolism, and the other one is a ketosis, when you are obtaining energy from fats or ketones. If you are eating a vegetarian diet or Western type diet, you are obviously running your body on glucose. If you are eating a carnivore diet, then you as well be running your body on glucose, because the excess protein will be converted into glucose. And that can result in higher than optimal glucose levels and other laboratory alterations. So, but the major thing, the background of the fatigue that you have on the carnivore diet is coming from the less ATP that is generated from the same amount of food. Okay, so if you're in ketosis, you will be obtaining 2.6 times more ATP as compared to any glucose-based metabolism. If you are in ketosis, you will need much less antioxidants and minerals. Okay, because there is this interaction between the glucose and certain vitamins, like the interaction between the vitamin C and the glucose, which is now quite well known. The similar thing is existing between the glucose and the magnesium, and it is existing for many other pairs of nutrients. If you are eating this 2, 3, 4 pounds of meat, you will have to eat for the same amount of energy. So your belly will be always full. You have to produce more digestive enzymes, okay, to digest what you have been eating. And this can result in a bad breath, for example, or feeling full. and a lot of protein will result in diarrhea. And you will also have to drink more water, because the higher the glucose level in your blood, the more water you have to drink on. So there are several downstream effects of eating too much protein and not eating enough fat.
And how much protein should people aim for? This is something I discuss a lot, and I'm trying to understand for myself. I agree with you. It does seem like there is a certain need for protein in our human bodies, and that once we exceed the need for those building blocks, excess protein is probably not beneficial for humans, and potentially is even harmful, because we have to just excrete the nitrogenous waste in the form of urea. And as I spoke about when I debated in a friendly fashion with Ted Naiman on a previous podcast, if we exceed the ability of the liver to convert amino acids into urea, then it can potentially spill over into ammonia, which could be dangerous for humans. But for your folks at Paleo Medicina, how much protein do you tell them to eat? Because I feel like if you can give them a target for protein, then they'll know the fat amount as well.
Mm-hmm. So actually, ammonia accumulation is something like a very rare case. It is just a burden on your body, because it is channeling away the energy. Sorry, getting back, what was your last question?
How much protein do you recommend people eat? So how do they know what that sweet spot is?
So if you do the right correct ratio for the meat and fat, and eat according to your needs, eat when you are really hungry, you will meet the right amount of protein. So you do not have to calculate. If you want to hear a number, it is between 50 and 60 grams per day, and not more.
Not more.
So, yeah, this is something you can find in biochemical textbooks, even from 100 years ago, and this has been experimented, measured, and these basic biochemical facts do not change, as our body is not changing either. So it may surprise many that something like a small amount of meat is enough. But actually, why should you need protein? You need protein for the recovery of your muscles, especially if you are doing sports. If you're not doing sports, then this is really a minimal amount. And then you need protein for the turnaround of the enzymes. But your amino acids are also recycled. So not everything is lost. So that you have to replenish on a daily basis is not more than 50 grams, and the rest should be fat. So you can get away with eating a bit more meat than that, or a bit more protein. It is still okay, but I think it is not okay to eat 150 or 200 grams of protein a day.
Is there some variation for people depending on body size and the amount of muscle mass? There must be, right?
Yes, that there may be a little difference. But the 50-60 is for an average 70 kilogram male, for example.
Okay, that's lower than I'm eating, and lower than I had been recommending. So that's quite interesting. And so are you thinking that if you exceed 50 to 60 grams of protein per day in a 70 kilogram male, which is about 155 pound male, or 160 pound male, that you'll just get wasting of that protein?
Yes, wasting, and then you are putting extra burden on your body. But I do not really like saying exact numbers when it comes to meat, because it is really depending on more things. But this is the theoretical number.
So if somebody were to try eating that amount of protein and then having the fat ratio, and they were still hungry, do you think that would be their body signaling that they could eat a little bit more?
If they are really hungry, then it should be a good signal to listen to.
To get a little more of that.
Yes, but the feeling of hunger has a big emotional component
Sure.
as well. So you have to
Yeah.
you have to learn, listen to your body, and
Yeah.
differentiate what is a signal of a real hunger,
Hmm.
or what is emotional hunger, or something else.
Right.
People usually also confuse having low energy with being hungry.
Hmm.
Okay, and that can aggravate things. So, for example, they're already overeating the protein, and then they are feeling hungry at the same time,
Hmm.
and they are eating more meat, which definitely doesn't help the situation.
So are there certain, you've essentially already enumerated these, but are there symptoms people should look for that might indicate that they're eating too much protein, low energy, these type of things?
The best feedback is coming from the blood work, because that is objective.
Hmm. And again, you talked about looking at inflammatory markers, BUN. I like to give people really specific things that they can look for in their blood work, or they can look for with their physician in the blood work. What would be an indication on the blood work that there's too much protein going on?
As I said, BUN, creatinine, uric acid, and glucose. But I wouldn't suggest patients to monitor their own condition by the blood work, because this is a specialization, and
Yeah.
there are a lot of things
Yeah, there are a
you
lot of
have to
things.
take into account, and self healing or self applying things doesn't always help. It's another thing that you cannot visit your doctor for
Yeah.
help, because he's likely out of the context. But my experience is that patients are not really good to put things together, because they're not experienced. They do not have the right background education, and this is something I do not know from yesterday. I'm doing this for 8 years, and then I had 20 years of education. So
Right.
it's all and add up, and this is something different from being an influencer or a podcaster. I mean, podcaster only, just led by experience, because
Right.
in this way, one one blind person is leading another, and that is not good. And
Yeah.
now my my impression is that even the carnivore diet, or the low carb, is getting more and more diluted, and being mixed up with several unscientific concepts, which
Mhm.
may sound scientific but actually not scientific.
Mhm.
And the blood work is really influenced by the medication, and whether the medication has been matched to the diet that the patient is actually following. And if it is not taken into account, you can really lose the whole thing.
Yeah, it's quite complex. You hit on a very good point there that I have heard repeatedly from people, and I think is becoming something that is more and more common, unfortunately, that a lot of people can't do this with their physician, at least in the US, because there are very few physicians who are used to seeing people on ketogenic diets, much less Paleolithic ketogenic diets or carnivorous diets. And so they'll take the blood work to their physician, and the physician just kind of throws up their hands and doesn't know what to do with it. So I like to give people some ability to do this, and I hope to provide some resources. But yeah, I think your concerns are well taken, that for a lot of people, if they're getting into the weeds on the blood work and they're confused, they might want to connect with somebody who can help them interpret this at a more professional level as well. So what glucose ranges are you looking for? Because I think glucose comes up a lot in this scenario.
So the glucose can be as low as 2.5, and it is still not if you're eating enough fat, then it is still not a too low glucose level. Usually it doesn't go lower than that.
Mm-hmm.
And the upper limit of what is accepted is 4.5.
4.5. So
This is the
2.5.
target.
What's that?
4.5, yes.
Right, right. And I want to convert those for people to units
It
that we
should
might be
be
more familiar
between
with.
60 and 80 milligram per deciliter.
Perfect. And that's a
For,
fasting glucose.
yes, this is a morning glucose, but actually it shouldn't change much throughout the day. if you are doing the ratios correctly.
Yeah. Do you ever have your clients check postprandial glucose levels?
Yes, they do.
Mm-hmm.
And if they are doing this correctly, this is more or less the same.
Yeah, the continuous glucose monitors that I've seen on a carnivore diet are essentially flat lines.
Yes, exactly.
Do
That
you
is
ever see discordance between the level of fasting glucose and hemoglobin A1C? Because I've observed this a little bit. People will have a fasting glucose of 80 or 85 and then a hemoglobin A1C of 5.3 or 5.4. And I wonder if in some people, these type of diets, ketogenic diets, will either prolong the life of the red blood cell or something, because I know how this looks on a continuous glucose monitor. I know that people on ketogenic or mostly carnivore diets are not going to have postprandial glucose elevations. So I think this is an interesting finding of discordance between a fasting glucose, postprandial glucose, what I see on a CGM, and the reflected hemoglobin A1C. Do you ever see this?
Yes, very often. But I think you should be concentrated on the direct measures.
Mm-hmm.
So if you are interested in the glucose level, you have to look at the glucose level,
Right.
not the hemoglobin A1C, because it is a indirect measurement.
Right.
And it is not just reflecting the glucose, but many other effects.
Like what do you think, any thoughts about what could be going on with this discordance, or what else could be affecting the hemoglobin A1C?
Inflammation, for example.
Okay. Inflammation could be raising the A1C?
Yes. Exactly.
Interesting. Okay. Yeah. And I wonder about, we just don't have a good way to measure the life of a red blood cell in people. And in speaking with my other colleagues, I don't think it's ever been measured in ketogenic dieters, whether the red blood cell lives a longer amount of time. The general life of a red blood cell is 90 days. And so it's assumed that a hemoglobin A1C gives us a proxy for the average blood glucose over 90 days. But if the red blood cells were living longer, perhaps because of increased membrane stability as a hypothesis or other issues, perhaps the A1C would elevate and would not be as accurate a measure. I think people end up going to their physician and they'll say, oh, your A1C is 5.6. This isn't good. But their fasting glucose is, mid 80s, which, might be a little high for your standards, but for most people it's probably okay. So that's quite interesting. I want to get into the PEG 400 testing because I think this intestinal permeability is super fascinating. One of the most striking things that I've seen come out of your group is that you've done so many of these PEG 400 tests on people. Maybe we could explain what PEG 400 testing is and the types of things that you've seen help improve intestinal barrier function and that have also broken barrier function, like maybe supplements.
Mm-hmm. So the PEG 400 test is, in our opinion, the most specific measure or the tool for measuring the intestinal permeability. There are other measurements in the market. There is a simple blood test as well, and there are the so-called differential sugar absorption test. They are intended to measure the same thing, but they are not as specific and are influenced. And in the first place, they are influenced by the diet the patient is following. And in the first place, it is influenced by glucose, fructose, and things like that. So it is really not a good idea to use other tests if you want to do the testing in a specific diet. So the leaky gut is brought about by certain food items that are in the diet that you are not supposed to eat. They are resulting in small microscopic holes on the gut, and through this gut hole, certain proteins or polysaccharides may be absorbing. So normally there should be no absorption, only for amino acids, fatty acids, sugars, monosugars, but nothing else. If other bigger molecules get into the circulation, they may be triggering autoimmune processes or autoimmune conditions. And the PEG 400 test is a test through which you can measure this phenomenon, because normally the intestine is not permeable to this material, to this PEG 400. And still, if there is some PEG detected in the urine, because it is first absorbed in the urine, then your kidney is excreting it in the urine. So you measure it in the urine. It means that if it is higher than the reference range given, it means that there is an increased intestinal permeability. And the PEG 400 is a mixture of these, so to say, PEG molecules that have at least 11 different sizes. So the end result is something that is graded. So you can look at specific molecular sizes, and you can see specific permeabilities for these specific molecules. So this is how intestinal permeability is measured. And there has been many attempts in the past to normalize intestinal permeability because it has been suspected that is related to several autoimmune diseases and also cancer, but there was no means to overcome, to solve this issue. And actually we were the first to demonstrate that an increased intestinal permeability was reversed, and this was reversed by a diet containing only meat, fat, and organ meat. And since this first instance, we have replicated this many times.
In the US, within functional medicine circles, there's lots of talk of leaky gut. And as far as I can tell, it's a very important thing for us to be thinking about. And the problem in the US is similar to what you described. We don't have a great measure for intestinal permeability. I've used zonulin, which you mentioned, and there's a stool zonulin and a serum zonulin, and they both do not appear to be accurate, neither sensitive nor specific to me. I know that in the body, zonulin is produced by the liver, so a serum zonulin is certainly not going to be a great indicator of intestinal permeability. And a stool zonulin also appears to be confounded. It's not quite as sensitive as I would like to see it. And then you also mentioned the lactulose mannitol testing, which is this comparison of two different size sugars. And that one has been studied, but might also not be amazing. So the PEG 400 is intriguing. In the US, I believe that we can obtain PEG 400 testing through some labs in England, and it's not terribly expensive. So I might start using it more in many of my patients. But the work that you guys have done showing normalization of the PEG 400 testing with the diet is quite intriguing, and I'm excited to see more and more. And so just so people understand what we're doing with PEG 400 testing, as you described, the intestinal barrier, the barrier between epithelial cells and the inside of the intestine should be tight, and we should not be allowing anything large across that barrier. Amino acids, fat, and monosaccharide molecules like glucose should be able to pass, but nothing else should be able to go through. And so polyethylene glycol is a larger molecule. It shouldn't be able to pass through to any great extent. And as you said, the PEG 400 testing, people drink a solution of 11 sizes of this polyethylene glycol, which is a large sugar molecule. And then we can look in the urine to see how much of that is excreted. And the inference is that if it's excreted in the urine after you drink it, you absorb it from the gut, and the gut is hyperpermeable. One of the things that I found most interesting about your work was that the removal of supplements was often crucial for full normalization of intestinal epithelial barrier function. That is something that I will talk to many clients about, many patients about. I think that in the US, we never imagined that the supplements could be causing us problems. But you guys are noticing that medications, which would obviously be a little bit more carefully removed from a patient, I'm not telling people to stop their medications unless they talk to their physician, but medications and supplements can have these binders, hydroxymethylcellulose. And do you think that these could potentially be triggering hyperpermeability in the gut?
Yes, actually, we firmly believe this because pill medicine can be packed with several materials, including lactose, which is one of the major issue with the pills, and even the coating may be containing several components that is not good for you. And if you have an autoimmune reaction, you can react to a very tiny amount of a bad thing. this is how the autoimmunity works. And it is enough to maintain. So, for example, that's why we tend to swap medication if there is a need to take a medication that is containing lactose for something less that is without lactose, and there will be still problems, but the lactose problem may be falling out. But this is surprising what a difference can it make. But this is what we experience from directly examining patients. So the symptom.
So you might swap. Would you have patients go to like a compounding pharmacy to remove the binders on these medications? You'll often swap formulations of these medications.
So the end goal is so that the patient become medication free in one or the other way, because there is no full recovery without removing all the medications.
Yeah.
Yeah. And just one thing, getting back to, you have mentioned that the PEC 400 test may be available, but I know that it is not available in the US. It is available in the London, the biolab, and it is available at us, but nowhere else so far, because the methodology is not easy.
Right.
Form.
Can people in the United States get a PEG 400 test from you guys without going to Hungary?
Yes, they can. We are shipping the test material by post.
Okay, interesting. That's cool. And at the end of the podcast, we can talk about how people could get in touch. But that's a great option for people if they're interested in knowing and following their intestinal permeability. And I know about Biolab in London. I think that might be the other place that I was aware of that could ship to people in the US. You mentioned lactose, which segues into the conversation about dairy. Let's just touch on this a little bit. I get a lot of questions about dairy. I'm not a huge fan of dairy. Some people may tolerate it. I've discussed A1 versus A2 milk in my blog posts on my website. I think I know what you're going to say here, but what is your feeling about dairy? What do you do with dairy in your clients? I mean, we've already kind of talked about PKD, but let's just talk about dairy for a moment.
Dairy is one of your major enemies, whether you are healthy or diseased, especially if you are diseased. So there are several components in the milk because of that you should exclude it. So and the lactose is just something like being most famous for.
Right.
But the major thing are the milk proteins, and there are several milk proteins, and they are just triggering autoimmunity. So there are. For example, there are animal models where the multiple sclerosis has been triggered by milk protein, because there is a specific link between the milk protein and specific diseases, and the other one is the type 1 diabetes. But the milk or milk consumption has been related to the development of autism or eczema, allergy, upper respiratory tract infections in general. So there are many downsides of the milk and dairy.
This has been my personal experience as well, and I've talked about this a little bit in the past. The casein protein, which turns into beta-casomorphin, has been studied with regard to many of these autoimmune diseases, and specifically the concern in the literature was that the A1 variant of casein might be triggering autoimmunity. And so I had no milk in my diet for many years, and I thought, well, maybe I can tolerate A2 milk. A few months ago, I did this experiment. And so I only did raw goat milk, and I was very careful about only getting milk that was A2. And there's A1 and A2 variants of casein, which turn into different variants of beta-casomorphin. But within 4 to 5 days, which is completely consistent with the time frame of a delayed hypersensitivity reaction and sort of a T-cell based reaction in my body, my eczema started to come back when I introduced even raw goat's milk, A2 dairy. And I thought, well, that's the end of the story for me. As delicious as it is, I could definitely tell when I was drinking it that the lactose was affecting me and kind of affecting satiety in some ways. I liked the fat. Certainly it was enjoyable, but for me, it triggered my eczema. So I'll just urge people to think about that as well. And most people, when they ask about dairy, especially people that are sick or have autoimmunity, I will similarly recommend avoidance of dairy, at least in the beginning, to see if that is part of the equation. And people can always try and reintroduce following the symptoms.
Yes, actually, there's no big difference between A1 and A2.
Yeah, maybe it's just a fallacy. And I've spoken.
The casein is only one protein, and there are so many others. And the milk is full of growth factors that is triggering obesity, tumorigenesis, and they are still there, whether it is A1 or A2.
Right. Let's talk about a few cases that you guys have treated. I know according to your website, it says that you guys have treated over 4,000 patients. The number is probably larger by now. And on the Paleo Medicina website, there are some impressive case studies of people with ulcerative colitis, type 1 diabetes, glioblastoma multiforme, which is a brain cancer. There's even a cervical intraepithelial neoplasia, which is a cervical cancer case that I would encourage people to go check out. But let's talk about some of the more striking cases to illustrate for people some of the things that you guys have seen with this intervention in Hungary. So what comes to mind for you? What sort of cases would you like to highlight for people?
Maybe the most intriguing is the type 1 diabetes, because it is a disease that is regarded to be incurable. And what you can achieve with the PKD is actually more than you can achieve with any low-carb diet or a carnivore diet. And this is a very important distinction, because you can read published articles on type 1 diabetes patients treated with a low-carb diet, a ketogenic diet, and they benefit. But you have to specify the benefit if you would like to compare it to another diet. So with a low-carb diet, any low-carb diet, you can achieve normalizing glucose levels, decreasing the need for insulin, and preventing hypoglycemic episodes. So this is the three major benefits that you can achieve with any low-carb diet. But in addition, with the PKD, if you intervene early, close to the diagnosis onset, you can have another two benefits, and this is becoming completely insulin-free. And the other one is that the own insulin production can be restored, which is actually amazing if you think into it. This is not possible with any other therapeutic tool, which means that these patients who are generally children, small children, can be saved from lifelong using of insulin. So this is something you can achieve, and we know, because we measure the C-peptide production. The C-peptide is something that is reflecting your own insulin production, and this is to be measured if you would like to follow patients whether they still have their own insulin production, because otherwise it is trending to zero in a year. And what we have seen, that these children or young adults who really adhere to the diet can maintain their C-peptide production through years. So now the longest follow-up is 3 years, and this has been replicated many times, actually dozens of patients. But of course, the adherence is a critical issue
in children.
Yeah, in children specifically, it is a very difficult issue, social issue, everything. It is so difficult, and it is not so more often than not often. They stop doing the diet, but those who stick to the diet can remain insulin free. But do not try this alone. This is something that you really shouldn't do alone at home without a medical guidance, because balancing between the diet and the insulin is something that requires guidance from a day-to-day basis.
Yes, it would be quite ill-advised for people to do titration of insulin in type 1 diabetics on their own. They should work with a physician. But what you're highlighting here is quite remarkable. And I will just clarify this for the listener. Mostly when we are talking about diabetes on this podcast and other podcasts, we are talking about type 2 diabetes, which has to do with insulin resistance. And there are many times in previous podcasts that I've spoken about potential mechanisms for insulin resistance. But in type 2 diabetes, the pancreas continues to work until it's exhausted. Type 1 diabetes is a different situation. It's an autoimmune condition, often presenting in childhood, but sometimes even presenting in adulthood, where the immune system attacks the pancreas. And this is why we see things like anti-glutamate decarboxylase or GAD antibodies in type 1 diabetics. There are specific blood markers. There are autoimmune markers that we see to differentiate type 1 from type 2. So a type 1 presentation classically happens to a child in their younger years, and the immune system is attacking the pancreas and essentially destroying the pancreas, to the point that in type 1 diabetics, the pancreas traditionally has been characterized as not being able to produce insulin. So it's a very different situation. There's no insulin or extremely low insulin in type 1 diabetes, and in the early or middle stages of type 2 diabetes, there is high insulin because the pancreas is working overtime to counteract the insulin resistance present in all of the tissues of the body, be it the liver, the muscles, or other tissues of the body in type 2 diabetes. So type 1 diabetes is not as much about insulin resistance. It's about autoimmune attack on the pancreas. And this is mirroring other autoimmune disease that we see where the body will attack the brain, or specifically the myelin sheath and neurons in multiple sclerosis, or the thyroid in autoimmune thyroiditis, which is also known as Hashimoto's thyroiditis, generally speaking, or the joints in rheumatoid arthritis, or the skin and things like lupus or eczema or psoriasis. So this is more of the classical autoimmune model. So what Zsofia is describing here is so remarkable that if an intervention like a paleolithic ketogenic diet, if you're catching it early enough in a child with an autoimmune disease, you can stop the autoimmune degradation of the pancreas. And as you're suggesting, even see the pancreas begin to make its own insulin again. This is really not something that's been documented in mainstream medicine, and certainly giving a type 1 diabetic child insulin is not going to stop the autoimmune destruction, and they're basically committed to a lifetime of insulin unless they're able to have an intervention like this. Type 1 diabetics generally do not get insulin function back from the pancreas. I've heard of people on traditional carnivore diets, or people have messaged me on Instagram. I'm not sure exactly what sort of carnivore diet they're doing, but they do say that their insulin requirements go way down on a carnivore diet, which is intriguing. But what you're describing is one step further. If you catch it early enough, and I think this is probably true for all autoimmune disease, with the proper type of carnivore diet or low antigen diet, if we catch these autoimmune diseases, be they thyroid, multiple sclerosis, rheumatoid arthritis, type 1 diabetes early enough, we might even be able to preserve the tissue that's being attacked. And so you're describing C-peptide, which you mentioned it's sort of a fragment of insulin. It's a blood test that we do to measure your body's endogenous production. And you've seen C-peptide levels rise again in type 1 diabetics when they do this diet. That's pretty remarkable.
Yes, it is. Yeah, and the crucial thing is to be in time. And it is more so in type 1 diabetes than any other autoimmune disease.
Mm-hmm.
And that's where diabetologists should have their own responsibility, because what they are doing in Hungary is that they are dissuading patients and their parents from following the PKD.
They're dissuading them.
They are dissuading them. They did a statement on that is dangerous and patients shouldn't be following this advice. So they have been dissuading a lot of our patients who should have been saved, instead of being insulin bound for their entire life. And that is really sad, because once the opportunity is gone, there will be no second choice. Okay, so we have seen patients like this who change their mind, and again they change their mind, but the second attempt was not successful. So
Mm-hmm.
they they still have some of the benefits of the PKD, but they didn't come insulin-free anymore.
Mm-hmm.
And this is the same for certain tumors. When there is an advanced tumor, metastatic, and so on, you have to be on time, and you because you will not have a second chance.
Right. You have to catch it early.
Yes, because the time is gone, and with time, everything is just going downhill.
Right. Why are these diabetologists, why are these endocrinologists in Hungary? What sort of statements are they making? What sort of objections do they have to PKD? Why are they saying it's dangerous?
It is absolutely lacking any scientific grounding or arguments. So you will not be able to find anything like that.
They're just saying it's dangerous.
Yes.
Right. Okay. Yeah.
It is dangerous for the kidney, for example.
Right. Which we know is not the case. There's plenty there's plenty of research across all countries showing that animal-based diets are not going to hurt the kidney, and a PKD diet is not particularly high in protein. I think one of the concerns is that, isn't a lot of protein going to hurt my kidneys? And that's never been demonstrated. And I've heard multiple nephrologists echo that sentiment as well. So that is
actually kidney disease can be cured.
Can be improved.
So, yeah, we did have many patients with kidney failure, and their condition has been improving by applying the diet.
You know, one interesting thing that I'll highlight here for the listener as well is that one of my clients recently had her anti-nuclear antibody go negative after many years of positivity. So ANA is one of the non-specific antibodies that we use. Well, it's fairly specific, but not the most specific antibody for lupus. And she has been doing a carnivore diet for, I want to say maybe 6 months, 8 months, and her ANA is now negative. So she went from a positive ANA, a positive anti-nuclear antibody, which is traditionally considered in medicine to be one of the things that we use to diagnose lupus, to a negative ANA after doing a carnivore diet, which is pretty similar to PKD now. So she was really excited about that. And then clinically, all of her symptoms have gotten significantly better. So there's a clinical correlation, but even at a laboratory basis, we're seeing something similar to the C-peptide. It's not exactly the same system, but I thought that was so cool to see an ANA go negative. And I have seen in my clients anti-thyroid peroxidase, anti-thyroglobulin antibody titers improve and go down on carnivore diets. Again, if we're talking about
it is not a very good marker.
You don't think so?
I don't think so. They are not predicting, for example, in Hashimoto disease.
Right.
These antibodies are not predictive at all for the future.
Is there do you use anything else in thyroid disease? Do you have a better marker, or just not a whole lot of good markers in Hashimoto's?
It is again a complex issue, but the inflammatory markers are the best.
Oh, interesting. Okay.
And yeah, of course you have to monitor the TSH and the thyroid hormones.
Sure, absolutely. That's pretty striking with the type 1 diabetes. So let's just enumerate for people the type of conditions that your group treats at Paleo Medicina. I know there's cancer, type 1 diabetes, but let's just talk about the stuff you treated, and then I want to talk about a few other things before we wrap up.
Crohn's disease, colitis. Actually, we have come across all types of cancer, even heart cancer or very rare cancers. But the number one is the brain cancer, the colon cancer. By number, they are the most frequent. But actually, we came across everything, and the mechanism is the same. If you know the work of Thomas Seyfried and his unifying theory of cancer, this is something we really see reflected in our own experience. So actually, all cancers are the same. Of course, you have to have different means to follow up. Prognosis is different, but the mechanism and the way you can cure the disease is the same, because it is the same disease.
And Tom Seyfried is a researcher that I'll hopefully have on the podcast in the future. I had Dom D'Agostino on the podcast. They work together closely. There is a hypothesis regarding what is called the metabolic theory of cancer. And this goes back to Otto Warburg's hypothesis. It's a little bit too granular for us to get into at this point, but the high level suspicion or hypothesis that people are working on is that perhaps in some cancers, the majority of cancers, the problem lies in the mitochondria at first, and that when the mitochondria become broken, quote unquote, increased reactive oxygen species can then lead to damage to the nuclear genome. The way that I think of this is there's sort of a question in cancer biology and cancer therapeutics, whether it's the mitochondria that gets broken first or the nuclear genome that gets broken first. But we do see a lot of broken mitochondria in cancer. And the mainstream perspective on cancer is that it's the nuclear genome that gets broken first. But Tom's theory and the metabolic theory of cancer would posit that perhaps it's the mitochondria that get broken first. And because the mitochondria break, there is inadequate ATP production, and then the nuclear genome cannot be adequately protected because that is an energetic process, and then the nuclear genome starts to accumulate mutations. So that would be quite interesting. And as we know from any disease that involves mitochondrial dysfunction, which is many chronic inflammatory diseases, ketogenic diets, non-glucose-based metabolism seems to benefit those conditions. So it wouldn't be surprising in that case that a non-glucose-based metabolism, a ketogenic metabolism, might improve mitochondrial function if the mitochondria are broken. Would you agree with all that?
Yes, absolutely agree with that. But this is only half of the story. And the other half is about the intestinal permeability, because it is not at all the same what kind of ketogenic diet you apply.
True.
And if you look at the published studies, there is, and this is also something that may surprise, that there is almost next to no evidence that the ketogenic diet is indeed prolonging survival. Okay, so you always have to look at the hard endpoint of the disease, not something like an immediate
right.
or intermediate endpoint. So actually there has been many studies, but all of these studies has been using this erroneous version of the ketogenic diet that is based on vegetable oils, flavored yogurts, and all. Actually, it is a junk food based ketogenic diet.
There are a lot of dirty ketogenic diets out there. You highlighted the paleo cookies. There are so many keto cookies out there as well. And I love that you're highlighting this. And I think that this may be something that we really need to incorporate into our therapeutic models in the future. If we can't normalize intestinal permeability, we may not get clients and patients to where they need to be.
Yes, that is a key for sure.
Mm-hmm.
And we do see that those patients who continue to have higher intestinal permeability, their disease would progress.
It won't progress. And on the Paleo Medicina website, you have some published data regarding the survival of patients with cancer. I know there's a particular patient with glioblastoma multiforme, one of these brain cancers, that has a really impressive survival on the protocol. But I believe I saw that you had illustrated there that the survival for many of the patients with cancer was significantly exceeding that predicted when they were doing PKD in combination with traditional therapies. Is that right?
Maybe the other way around.
Oh, okay.
They survived longer
when
they were doing. This is what you have. What you said? Yeah. Then this is. Yes, I did a poster last year, and this was about the summary of our cancer patients who have been following the diet at least for 6 months, and I did see the difference between those patients who survived progression-free for at least 2 years and those who didn't hit this mark.
Mm-hmm.
And it turned out that all patients who remained progression-free with otherwise bad cancer are those patients who didn't do chemotherapy or radiotherapy.
They did not.
They did not, yes.
Wow.
This is what we see longitudinally. Mm-hmm. You know, we have many examples and counterexamples. For example, there is a glioblastoma patient so the glioblastoma is the most deadliest type of cancer, brain cancer. It equals to death in 6 months on average. But this was a patient who started doing the diet, only diet, and he was progression free for 2 months without any symptoms and no epileptic seizures. He retained full work capacity, and then he was persuaded to do the radiotherapy we advised against, but his oncologist suggested this, and from this point he started progressing, and he died at the end. And there was no possibility to come back from downhill. But there is another patient who you mentioned. I'm about to finalize the publication. It is already 3-year follow-up, still entirely progression-free.
Has the patient that has progression, the freedom from progression, have they done chemotherapy or radiotherapy for GBM?
The one who I am speaking of is a recurrent glioblastoma, which means that he underwent the surgery, then he received chemotherapy, radiotherapy.
Right.
And the tumor recurred.
Right.
And at this point, the patient decided to stop using all standard oncotherapy and went along with the PKD alone. Mm-hmm. And this part is the 3-year part for he is progression-free.
It's such a controversial topic, and families that are faced with cancer diagnoses are stuck in a very hard position. And I think that it's hard to navigate these things. And it certainly merits more investigation into whether these things can be useful adjuncts. And I think that there's everyone is just trying to help people, but it's a tricky situation. So one of the last questions I have for you is, early on in our discussion today, and we've covered so many good things, you mentioned that for some patients who may not be as ill, there's a version of the PKD, the Paleolithic ketogenic diet, where you include some what you called Paleolithic vegetables and fruits. I think that listeners may be interested to hear, what do you consider to be Paleolithic vegetables and fruits, and what sort of plant foods are included in some people's, as an option for some people who may not be extremely sick? What's your perspective on that?
So they can include some fruits, vegetables that are no nitrates or not legumes. Mm-hmm. So actually there's a wide variety, but to a smaller or bigger extent, all vegetables are our enemies. So you can feel the difference. It only means that they do not have a lasting effect on your health if you eat an apple from time to time, if you are otherwise healthy. Mm-hmm.
This is interesting. In the book that I'm writing, I have a version of the carnivore diet, which is called a carnivore-ish diet, which is sort of an American, Western colloquialism. But I think it's useful for many people to think about which plants might be less toxic. Certainly, I think you highlighted some of the ones that I would consider to be more toxic, legumes and nightshades. I also feel like seeds and nuts and grains are quite toxic. I'm sure those are excluded, and those are not necessarily Paleolithic types of vegetables. Again, I would echo your sentiment that I think that I feel the best when I don't have any plants, but for people who want to include some plants, I think a perspective on what might be the least toxic plants is also important. And my perspective, which is just a hypothesis at this point, is that avocado, non-sweet fruits, perhaps squash and lettuce are some of the least offending things. And again, in my book, I'll have a sort of a continuum of things that might be more or less toxic, but it's all just guesswork, and people might be individually triggered by various plants on a sort of idiosyncratic basis. It's hard to predict it. So thank you so much for coming on the podcast. Where can people find the work that you guys do at Paleo Medicina? How can they connect with you if they want to connect with you guys?
They can find me on my personal Facebook. Mm-hmm. I do have an account, and paleomedicina.com/en.
Okay.
That is our page.
And we talked about this earlier. I'll just repeat it for people. If people want to do the PEG 400 testing, they can obtain that from you guys, right?
Yes. There's a button for booking, and they can book different things, including a consultation and also the PEG 400 test.
Right.
So they will be able to find it on the same page.
And I'll also highlight that for people, that you guys do virtual consultations from Hungary for people in the US or throughout the world who may want to talk to you guys in more detail. And then can people come and visit the clinic in person? You see people in person, right, as well?
Yes, we are doing this intermittently. Mm-hmm. We are doing this event every second month. So it is not always there because we have other commitments.
Right.
But they can do a consultation, and now the consultation goes along with a 2-week follow-up. because usually a single occasion is not enough to
Right.
fine tune and introducing the diet, because there are so many issues that may emerge.
Right. And I know that Amber O'Hearn and Michaela have talked about coming to visit and seeing the clinic. And so I think many people may be interested in that. And then while they're there in Hungary, they can eat all the good fat that's so easy to get while they're in Hungary. And that sounds pretty nice to me. So this is my last question for you. I ask this to everyone on the podcast. In the US, I love to use the word radical, and it's kind of a slang term and it means cool or exciting. So I've started asking my podcast guests, what is the most radical, exciting thing that you have done in the last month? So tell me about your radical, Zsofia.
My radical?
Yeah.
Maybe skipping coffee.
Okay.
The radical experience.
We didn't even talk about coffee in this podcast. I am not a fan of coffee. What do you guys think about coffee?
Me neither.
You're not a fan of coffee? Yeah.
I have double feelings towards coffee.
Yeah. What are your double feelings toward coffee?
Because I like coffee, but I realized that I realized the side effects that the coffee is exerting on me. And actually, I think everybody is realizing.
Right.
Just not everybody is honest to themselves, but the coffee is compounds. So
it cut out there for one moment. What do you notice about coffee?
What my observation is, including me and others, that it can result in skin issues, skin symptoms, and that is not good. But many other symptoms.
Yeah. So it's pretty radical to cut out coffee. Not easy, but probably a step in the right direction for better health.
Yes.
Absolutely. Great. Well, thank you so much for coming on. I look forward to all of our future conversations.
You are welcome. Thank you for having me.
All right, you guys. I thought that was really cool to talk to Zsofia. The stuff Paleo Medicina is doing is amazing. I really appreciate the fact that they have published multiple case reports in the literature. I think it is undeniable that a carnivore diet can be a very powerful therapeutic tool. I'm not saying everybody has to do a carnivore diet. I'm just saying that I think most people would feel pretty darn good doing a carnivore diet. I do accept that for a lot of people, plants have become a part of the culture. And one of the other things that is important to consider with the carnivore diet message is that it's not about eating only animals. It's also about understanding that plants can be triggering for some people. And some plants might be triggering people more than others. You know, Dr. Stephen Gundry sort of popularized this notion of lectins, but one of the things that I'm interested in sharing with people is that there's much more than lectins in plants that could be triggering them. So yeah, it's great if you want to do a plant paradox diet. I definitely disagree with Dr. Gundry, though I respect him greatly in terms of the fact that he is not excited about meat. And I think that there is no evidence that animal protein ages us in any way, shape, or form or is bad for us. You can listen to my debate with him, but I like that he popularized the notion of lectins as plant toxins. But there are also tannins, polyphenols, which can damage DNA. There are many of these other toxins. There's oxalates. There are so many toxins, isothiocyanates. These are all plant defense chemicals, and they can be triggering to people in different ways. So plants can hurt us. Animals are definitely the best source of bioavailable nutrients. That's pretty darn hard to debate. And on the flip side, plants can hurt us. I don't think everyone needs to eliminate plants from their diet for their whole life, but I think that most people will benefit from eliminating all plants for some amount of time. If you want to use a carnivore diet as an elimination diet, I think that's a great application. A lot of folks want to stick with it. I think that's totally sustainable, healthy, and safe if you want to do that as well. That's what I do, and I'm really enjoying it. I continue to enjoy it. I've been doing it for more than a year, and I'm trying to kick a whole lot of ass, and I think I'm doing a pretty good job. I'm feeling really good, and I'm stoked about it. So I'm grateful to be a part of this community and sharing all this information. Like I said in the intro, I don't necessarily agree with all the things that Zsofia is advocating. I think that healthy discourse is important, and I just want to give you my personal take on this. I don't think we should be limiting food. If we're hungry, we should give our body nutrients. I don't think that we're eating too much food. That's the problem. I think it's that we're eating the wrong foods. And obviously too much of the wrong foods can be a problem. But though I appreciate fasting and time-restricted eating, I don't think we should be limiting our food if we are hungry. I think we should be eating as much nutrient-dense food as our bodies are asking us to eat with satiety and hunger signals, as long as we are eating foods that are not affecting us in terms of those negatively. And that's one of the great things about a carnivore diet, is that eliminating plants makes those satiety signals very clear, especially when we are preparing the meat properly and not overly cooking, overly grilling, overly charring the meat. I think if you guys experiment with sous vide, lightly cooked, water bath cooked, or even raw or blanched meats, you'll find that the satiety signal is very strong and very cool, very instructive to our bodies. I do think that her perspectives on fat are valuable. I think many carnivores could be eating too much protein. I don't think we need that much. And I think that there are other valuable nutrients in the fat and the organs that we should focus on. The organs do have protein, of course, but we should not exclude the organs in favor of the meat. And then I think that it's important to think about where we're getting those organs from and the different sources. Like I said in the intro, white oak pastures, definitely my favorite source for all of my stuff these days. What is going on with me? I am working hard on this book. It's going to be done really soon in terms of the first draft. I'm editing, and the manuscript is almost done, and then we will be working hard to prepare it. It's going to be published probably end of this year, early January. I'm going to be putting out the covers pretty soon. We've got a pretty awesome cover design. I'm excited to share it with you. So that's what's going on with me. I'm continuing to surf, ride the foil, take care of my passions, do self-care. It's also important to keep balance, but I'm so grateful to be a part of this community and sharing good information. Let me know how I continue to deliver value. I appreciate you all. I do. And check out White Oak Pastures. Use the code CarnivoreMD. Check out Ancestral Supplements and their new guts, intestines, and tripe supplement. And check out Native. Use the code Saladino at Native. Use the code SaladinoMD at Ancestral Supplements. And you will be well fed. You will have organs, either real organs from White Oak Pastures or Ancestral Supplements, and you will not smell badly because you have natural deodorant from Native. Check it all out, you guys. I will see you in next week's episode, which will be the deuterium episode, which will be really cool. Check it out. Catch you guys later.